Welcome to All Things Cardio-Oncology. My name is Steve Caselli. I'm the Executive Director of ICOS. And in this podcast, you'll hear from a diverse representation from our community. We want you to be both informed and inspired by their stories and experiences, and we're so glad that you've joined us today. Here at All Things Cardio-Oncology, we're introducing a new series where we plan to speak with patients and their healthcare providers who either were or are continuing to be engaged in their care. And we know that every situation is unique. It presents special challenges, but we can always learn from one another how to improve our treatment process as we seek the best possible outcome for all patients. And so today I'm delighted to have with me on the program Dr. Lalitha Medepalli, who is Medical Director of Cardio-Oncology at Northside Hospital in Atlanta, Georgia, here in the United States. So welcome, Dr. Medepalli.
Thank you, Steve, for the opportunity. Thank
Great
you very
to have
much.
you. And we are joined by one of her patients, Karen Rowland. Karen, thank you so much for being willing to speak with us today and discuss what we know are personal matters in your own life, but we really appreciate your courage and being willing to serve our community in this way. There are many people who will be helped by your story. So I want to first just ask you to tell us a little bit about yourself, your background, who you are, and then leading up to your initial cancer diagnosis and how that came about.
All right. Well, I'm glad to be here, and hopefully I can help and encourage anyone who's facing any sort of medical difficulty to know that just take it one step at a time and everything will be okay. But my name is Karen Rowland, and in September of 2022, I received a diagnosis that was pretty devastating. Stage 4 breast cancer, left breast. Just to give you a little bit about my history, I'm a university professor at Mercy University. I was living quite a busy life because not only was I teaching, but I was also the department chair at the time. So I had administrative responsibility. And, looking back, I can say that I was not as conscientious as I should have been in terms of taking care of my health. I was diagnosed with hypertension, so I was seeing a doctor every 6 months through Eagles Landing Family Practice, now called ALO Health. And it was after, I guess, experiencing a lot of coughing that just didn't seem to go away. I mentioned it to my doctor during one of those visits, and she did an x-ray. And after looking at the x-ray, she said, I need you to go to the emergency room right away and be prepared to be admitted. And so I did, and that's when I found out about the breast cancer. And like I said, looking back, hindsight is always better. I should have been a little bit more careful in terms of making sure that I got regular checkups. So if I can encourage anyone, make sure you get those physical exams on a regular basis.
Mm-hmm. That's good. And you mentioned a history of hypertension. Did you have any other cardiovascular issues prior to your cancer treatments or diagnosis?
That was the only thing that I was aware of. No cardiovascular issues.
Yeah.
No.
And then what was, again, from your recollection, Dr. Medepalli can fill in the details, but what was the basic course of treatment that you had to undergo at that point?
I had chemotherapy. I did that first, and then followed up, I had radiation. I had the left breast removed. And I think that was a treatment.
Yeah.
But the chemo was a series of, the chemo came first, and then there was some hospitalization and then radiation later.
Okay. And Dr. Medepalli, maybe tell us, how your referral system works. How did you meet Karen? And what's your
Right.
recollection of kind of her background, her case as it came to you?
Yeah, thank you, Karen, for speaking for Cardio-Oncology. So yes, a lot happened, when Karen was really sick. So what happened to make this information from her is so important is her, as she was led by her physician to the emergency room in September, that workup showed large fluid around her lung in the cavity called pleural effusion. So that was very large on September 4th, 2022. So, and the workup, they tapped the fluid from the chest wall through a needle, Karen, and then they removed the fluid, and then they did a CAT scan of your chest, which showed some spread of that cancer into the back, the lumbar spine, and then and they did a biopsy of that spine L1 transverse process, and that came back as we check as receptor status. The estrogen receptors, progesterone receptors called ER/PR, they were positive, but the other receptor called HER2 was negative. So now you got that diagnosis as of within a month, by September 3rd, that you were diagnosed with ER/PR positive, HER2 negative cancer, which spread to the backbone. So you needed immediate treatment right away, so that it's already the cancer is now, we want to limit the spread and take it to your survivorship. So Dr. Menchian, your oncologist, so she initiated you on a dense dose anthracycline doxorubicin-based chemotherapy, which can be cardiotoxic. So that's why she went ahead and checked your heart function, which showed normal heart function, 55 to 60%. We have in our protocol to get the baseline heart function, and then she started the treatment. So after getting a couple of cycles, they usually give 4 cycles. As of December, your heart, you started getting fluid again. You got short of breath, so they thought that pleural effusion is coming back rather than heart function going down. And you received the 3rd cycle, and by January, you got shortness of breath again. So then you were admitted at a different outside hospital. Like you completed 4 cycles by then, by January 30, 2023, in 3 months. And then you were in the hospital early AM around 3:30 with acute shortness of breath. And then they checked your heart, and your heart function was dropped to 20%. And your heart was weak at 20%. Your heart was stiff, grade 3 diastolic dysfunction, the large effusions on both sides of the lung. You were pretty sick, probably. That was too. Your family was with you for all your initial appointments coming to me, but at that time, the patient was intubated and on ventilator support, acute respiratory failure, acute heart failure, pulmonary edema, requiring removal of the fluid with the pleural tap again, and then ventilator support, and then finally, in a week, got discharged. So she completed the anthracycline therapy, but landed up with severe heart systolic pumping function and relaxing the diastolic dysfunction. And she also had a significant leaky valve called mitral regurgitation.
Wow.
Moderate to severe mitral regurgitation. She was optimized medically, discharged to home, went to a local cardiologist, not a cardio-oncologist. And then now Dr. Menchian is very, very aggressive, and she is like devastated with what happened. And then she picked up the phone and called me, and she said, Lalitha, this is the case. So we need her, we need her heart back up. And then, Steve, we talked about distance before in our previous meetings. to fill you in where Karen is and I am, we are about 83 miles away, that far. And then somewhere along in the midway is Dr. Menchian is, about 25 miles from her home, Dr. Menchian, and from her home to me is 85 miles, for God's sake. Distance did not become a bar for us. Karen had a wonderful support family who brought her in at that time. She was very, very sick when I saw her for the first time in March, around March or April. And so we said, your heart function is 20%, let's get this rolling. And then I got her admitted to our hospital here, Northside Hospital. Wow. And then we need to optimize your medical therapy. Heart function is low, so blood pressure was low. So the classic guideline-directed medical therapy is a challenge. So any medicine we start, blood pressure is not much room. So we need to make sure her angiogram is okay, our coronaries are okay. As you mentioned, no other risk factors are there. So she was a pro. She was she was so good in, yes, whatever it takes to get my heart back up, and her family. And then we got her admitted, got her cardiac cath. As you said, we look for risk factors, just the hypertension before, now blood pressure is low, no blockages to her heart arteries, coronaries were clean. She was started slowly one by one on her heart supporting therapy, what we call as guideline-directed medical therapy. Our heart rates were fast, so we used out of the way start medicine as Corlenar because blood pressure was low, so ivabradine, which we usually don't start right away, first medicine, and then metoprolol, and then slowly up titrated.
Could I just jump in and ask Karen?
Yes.
Like up to this point, so you've been receiving cancer therapy, obviously, and now all of a sudden you have these massive cardiovascular issues that you're facing. What was going through your mind at that time when you started to hear, oh my goodness, now my cardiovascular disease is involved in this process? What kinds of things were you worried about at this point?
I just wanted to get well. And, being the caretaker that I am, I was more worried about my family worrying about me. I was more worried about my kids worrying about me. And so they were always on my mind. People ask me, were you afraid that you're going to die? No, I really wasn't. I just wanted to do everything that I needed to do to get better. And so that entailed whatever the doctor said to do, I was going to do it. But I just wanted to, I was just really worried about my kids more than anything else.
Yeah, that's beautiful. Dr. Medepalli, you can continue. So once what kind of things did you do then? Well, maybe back up and tell me what was the decision-making process for treatment going forward with the heart issues? Is that a conversation that you have with the oncologist? Is it a conversation between Karen and the oncologist and you, or how were decisions made along the way?
So it was seamless. I mean, we had constant communication going between me and Menchian almost frequently, and almost every 2-3 days. And we both had our cell numbers texting, and Karen had my cell number too. So whenever we tried to do any up titration of medicines, her creatinine jumped up from kidney function got compromised. Her creatinine jumped up from one of the medicine we started called spironolactone, 1.7 to 2.7, with making her pee, getting the fluid off, and all these things going on. So we had to get her established with a local nephrologist in Macon, Georgia, where she is. And then it's a 3-way communication that way. From there too, I was texting that when she comes here, her lab work, and she's taking that lab results to her nephrologist there. And then we had to back off some heart medicines called spironolactone. And then I was communicating with Dr. Menchian. The main thing here I wanted to emphasize is the distance. Distance did not become a problem. The care was seamless, and communication process were ongoing on a almost day-to-day, week-to-week basis because the medical regimen had to be up-titrated quickly. And then meanwhile, Dr. Menchian started her on a hormone therapy, Armidex, which has no major cardiovascular, because she has ERPR positive, and postponed her mastectomy until October. So meanwhile, her medications were well adjusted. Her EF improved by the next 3 months to 35%. So we were getting the echo. So she used to make a trip every 3 months in between. We also talked in our previous webinars about televisits. We did that televisit. We alternate televisit with her driving in, and then communication with messaging and through our system to constantly get her, because she needs to get optimized for mastectomy. She needs clearance for that. So her heart function is too weak, 20%. So we got her optimized, and when we got her echo checked, her heart function is about 35% by October. And then she was able to proceed with her left side mastectomy. So one step forward. And then we still had to figure out the timing for left-sided chest radiation. And then we needed back L1 radiation. So we had all these lined up in the back screen between me and Dr. Menchian.
Yeah.
Yeah.
So Karen, it sounds like during this process, you were incredibly cooperative with your physicians in their care, which is wonderful. Were there concerns that you had about continuing your cancer therapy in light of the cardiovascular complications?
Absolutely not. I mean, there was no concerns. My husband and I, we were determined that we were going to trust whatever the doctor says to do, because they're the ones with the medical degree. But we also, our faith in God was also important to us. So we had, my husband was a pastor at the time. He's no longer pastoring, he's retired, but we had the church that was praying for us as well. So our faith really helped in the process, but we also knew, we're going to have faith in God, but we're also going to have faith in the doctors as well. So we were determined to do everything that we were told to do.
That's wonderful. And do you have what advice might you give to others who are like facing a similar journey where both cancer and cardiovascular disease are involved?
I really would say take it one day at a time. I mean, there were some days I was so sick, I didn't know what was going, whether I was coming or going. Make sure you have a great support system. So my husband was there 24/7, wherever, if I needed to go to the doctor, he was there to pick me up. That you have a great support system, but more importantly, listen to your doctors. If your doctor tells you to do something, don't go search on Google and say, well, Google says such and such. No, listen to the doctor and do what the doctor says to do. That's my best and greatest advice.
I'm sure Dr. Medepalli really appreciates the caution about Dr. Google, which we
That's right.
all do. If you or your institution would like to have credentials that confirm your qualifications as a cardio-oncologist or a cardio-oncology center of excellence, we encourage you to consider applying for our certification exam in cardio-oncology or our certification for centers of excellence. These are the only certifications currently available in this field, and it's a special opportunity for you or your institution to distinguish yourself recognizing your expertise in the field. More information about both these opportunities can be found at ic-os.org, or you can email directoricos@gmail.com for more information. Lalitha, could you talk a little bit more just about, I think one of the potential fears or concerns with cardio-oncology is if there's cardiovascular problems, that's going to, interrupt my cancer therapy. Can you just, in this case, it's very clear that that was not at all what your effort was. Your effort was actually to continue that therapy. Can you just comment on how that works together?
Yes, very, very important. For Karen, what happened was the pleural effusion misled. So on all not, she presented as a cancer patient because of pleural effusion. So when that adriamycin is at risk for heart failure drug, even though Karen had only risk factor of hypertension, still this happened. So when she was getting, when patients are getting, we have a survivorship and an adriamycin ongoing plan. If they get symptoms of shortness of breath, chest pain, palpitations, dizziness, arrhythmias, anything, swelling, not just thinking of cancer and cancer treatment side effects, but think of cardiovascular comorbidity may be happening and toxicity may be happening. Quick echo, quick lab work, quick chest x-ray like Karen did quickly to figure out there is nothing else is happening is very, very, very important. And then distance is not a problem. These days with COVID had one good thing in there. We developed televisit. So we can mix. I do one time full visit, one time televisit kind of thing. That way we can get the imaging when the patient comes for that club together and then televisit. And then, as Karen said, she was a pro. She was the best, one of my best patient, and her husband, best family I ever had, and indebted for her trust in me as a cardio-oncologist. It was very rewarding, and to see the to have a great conclusion point for her care. Steve, as of January visit, her EF is 55%. Her diastolic dysfunction from grade 3 is back to 1, and moderate to severe MR. At one time, we were planning of a clip as a bridge to her mastectomy, and radiotherapy of left side is gone. She has only mild MR and no pericardial effusion, no pleural effusion. And her recent scan from Menchian scan sent me showed no trace of any cancer ongoing. She's stable on maintenance therapy with Armidex and Ibrance. And from cardiac standpoint, few medicines, 3 of the 4 which we usually give, and she's off Carlenor, and her heart rate is great, and she's euvolemic, and she's a true survivor in both ways, both from breast cancer and from cardiovascular toxicity. So that was a very, very fantastic outcomes from both sides, cancer and cardiology and oncology aspects.
Yeah. That's
Thanks to my great doctors. Thank you, Dr. Medepalli. Thank you so much.
Yes, we have a good team.
It's such a wonderful story, a wonderful outcome. Karen or Dr. Medepalli, either of you, what is, just in closing, sort of the path forward now? What kind of monitoring will you need to do in terms of these cardiovascular issues? Anything going forward that you are dealing with?
I will follow whatever Dr. Medepalli tells me to do.
Sounds very wise. Dr. Medepalli, what would you recommend in a case like this in terms of cardiovascular follow-up in particular?
Yeah, we keeping up with appointments, as Karen started off this conversation, because it's hard to with as she has so many tasks, children, husband, her own job, and being a educator, preparing for that and things like that. So sometimes can be misleading, and then, you may be tired blaming on that rather than cardiovascular health, blood pressure, and comorbidities. I kind of talked to my patient, the previous publication from Cardio-Oncology World about ABCDE is a good way to remember things, being aware of the heart went down and came up. So blood pressure management, checking periodic blood pressures. To some who can't afford, we are even providing from Northside System Foundation the blood pressure monitor free, and then trying to keep up with her cholesterol, A1C, and like a B for blood pressure, C for cholesterol, and she doesn't smoke, cigarette smoking, D for diet and diabetes, and E for exercise. So we kind of stress on these risk factor modification. And I checked her echo initially every 3 months, went up as the heart function resolved, EF back to normal for the first time. We had that record on the January echo. So probably this time we'll check in 6 months. That's where she is on. She'll make that 80-mile trip and then get the echo backed up at the same time, and then maybe go to once a year kind of thing. Meanwhile, Dr. Menchian is also extremely proactive oncologist in our Northside system, and she is she picks up the phone and calls me right away if in case any suspicion of anything going on, and she doesn't hesitate, even patient has other cardiologists, to get the cardio-oncology care going. Then we sign back to their cardiologist.
Great. And Karen, any closing thoughts for others who face the same?
Hang in there and take one step at a time.
Yeah,
one day at a time.
That's good advice. Well, thank you both for joining us today. It's such a wonderful illustration of the value of cardio-oncology, collaboration between cardiologists and oncologists, and patients having a voice in their care. I know that our community is going to be greatly helped by you being willing to share your story, especially Karen. Thank you again for being willing to open up and share these things. I know many people will be helped as a result. So thank you both for your contribution to our efforts to treat cancer and protect hearts.
Thank you. You're most welcome. Appreciate it.
Such a success story for Karen. It's a celebration for me, actually, her story is.
For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.